activity. They say, no, I have just joined gym. Joining gym is not only thing which will make them lose weight. The gyms, as Dr. Prem said, it is not the apps alone. The gyms also give attractive, offers. They give whole year subscription. They go only for 10 days or so. They don't go after that, saying they give promise that they go regularly, but they don't do it. If they ask, if you go for a walk or if you're going for a gym, they say, I'm too tired, too cold, too hot, it's raining, it's too late. And it is that they have to have a motivation, whatever you are doing, whether it is app-based or you are going to a gym. So excuses don't kill the fat, it is exercises. They have to realize that these are very important than having a motivation is more important. So some say, I haven't gone for a gym today, but it is for years together they have not gone to the gym. So they say some reason or the other, and Dr. Prem has mentioned there are many apps now which are available for weight loss. You have to choose the right one. Money is there for everyone. We have VNCC, Colors, and various gyms also gives good offers. Take money, and you ask the patient who goes to Color or VNCC, they mostly are unhappy. So if you follow, then it is not much of a problem. The other thing is there are many papers now from 16 to recent. There are many papers which also says that weight loss apps can help patients lose weight if they are adhering. In that study, actually, there's an interesting thing. Whoever there are weight loss, they lose weight anyway if they use the app. About 40% of patients, at least you lose about 5 to 10%. And if you see, after more than 5%, there are more males who are losing weight when using app than females. And whenever we are using the app, you have to enter the data, whatever they are saying. If they are asking you to put the weight input frequency, breakfast input frequency, or lunch input frequency, or the other frequencies, dinner and calorie intake, physical activity input. People who are entering the data usually have a good weight loss and good blood sugar control. It is the same for diabetes as well. Even if in your clinics you would realize that patients who are coming to you regularly have a good blood sugar control than person who doesn't come to you regularly. So this is the one which I use. Even during COVID period, I was walking regularly, and a policeman stopped me and said, why sir, you are walking, nobody is walking, why are you doing this? So then I realized I have to do something else. And I went through all the YouTube and apps, and this is what I got, Team Body Project. It's a very interesting one. If you could try that, can use 10 minutes or 15 minutes or 30 minutes of your time using this, and it is very useful. If you do 30 minutes of this, it is like running 5 kilometers in a row. I tried myself for my patients. I started a YouTube channel and started Dr. Srini's Walk and Talk, but I didn't continue it. It is on the hold with my assistants, doing for 15, 20, 30 minutes. Great, patients appreciated it, and they said that they are using it. As both the speakers pointed out, there are advantages and disadvantages. They have gone through everything together. So the main thing is you can access it remotely everywhere. Last week I went to a conference to Chennai. I couldn't go to the gym, so I used it in the room for 30 minutes, and it was useful. You can on it in a TV, YouTube channel, can do the physical activity and also follow their dietary advice to a certain extent, not to a great extent. So it is cost effective. Paying to a gym for 1 year, if you are joining an app, it is less than that. If you have motivation to continue or continue with the app, it will be useful. So long-term potential also there. So it has personalization, as Dr. Venkatesh has mentioned. There are a lot of features and functionality which can be used in an effective manner. So disadvantages are also there, as Dr. Prem pointed out. It can the data privacy and security is one of the important things where you can it can be sold to other people, or they can have access about your private data easily. It is also available in the EMRs as well now. So research and regularity needed. You can have long-term studies on it about the tool and support for individuals. Apps can be effective as an adjuvant to traditional programs or low intensity intervention. And addressing, if you address the limitation, it is going to be a useful tool in future, and it is a useful tool if you use it properly. That what would be my conclusion. Thank you all.
Let's move on to the therapeutic symposium on pregnancy. Now I request Dr. Bhavadharini Madam to take over the session. Thank you, ma'am. We welcome you on behalf of RSSDI. Over to you, ma'am.
The respected chairpersons and my dear colleagues, very good morning. Welcome you all for the TRAC 25 at Coimbatore, our place. And coming to obesity and pregnancy, nowadays it's a day of obesity everywhere. If you take obesity as such, you can see obese people being metabolically obese, and also some obese people are metabolically healthy, keeping themselves fit. And again, during pregnancy, if you see, majority of the females, they put on more weight, gestational weight gain. That is again causing all the problems like obesity. So in this way, and not only this, even the normal weight people, if you take, they may be by weight, they may be normal, but still they'll be metabolically unhealthy. In such a way, they'll have some visceral obesity, which is causing all the problem. In this way, all this should be how to say that she is metabolically healthy and not obese. It's not only obesity, so it's either way. And you see, every tree, every growing thing as it grows says this truth, that you harvest what you sow. It's also again in pregnancy, your children will be what you have done. And the mother, whether she has a fat-free mass or fat mass via placenta, it is all transmitted to the fetus in the fetal growth as fat-free mass or fat mass, and also it is expressed in the amniotic fluid. Not only that, during pregnancy and birth outcomes, like it has consequences during pregnancy, on delivery, and also increases the maternal morbidity, mortality. And what happens after the child is born also, it is carried over. That is, the lactation milk formula is changed, and it has weight retention, postpartum weight retention, and also causes postpartum depression, which is very common, which we are not thinking about it. And also it has long-term consequences both in the mother as well as the fetus. And starting right from the early development, that is in the oocyte blastocysts itself, the genome-wide and DNA methylation, if we say, it causes epigenetic changes, programming of the stem cells, and it causes placental changes. The transcriptome and epigenetic analysis shown that there is alteration in the nutrient transport to the fetus, all gets changed, and there is increased inflammation, lipotoxicity, and affecting the programming of the neonate. That is, the microbiome is totally altered. As I said earlier, the milk composition is altered, and not only that, it programs the metabolism of all that is fat amino acids and proteins, and causes all cardiometabolic risk later in life. And if you take the risk as such because of obesity to the mother and fetus, and also at birth, if you take, of course it causes gestational glucose intolerance, any form. It can be in the form of GDM or pre-diabetes, and also it causes, because it is the insulin resistance is the basis, so it can also cause gestational hypertension, preeclampsia. It can cause increase the thromboembolic phenomena, and it causes pelvic pain during late pregnancy because of obesity, and there occurs obstructive sleep apnea and post cesarean wound infection not healing, and postpartum complications like anemia because of dilution, depression as I said, and weight retention which is not reverting back, and there is lifetime risk of cardiovascular diseases. And again it has problems like structural birth defects causing congenital anomalies in the baby, and also big baby, prematurity, preterm, and hypoglycemia, stillbirth sometime in the extreme, and NICU admissions, asthma, autism, attention deficit and hypersensitive disorders, and early development of metabolic disease. That is the main thing caused both in the mother as child, and it has also as problem during delivery, that is increased rate of cesarean section, failed induction, uterine rupture, and as I said metabolic morbidity is increased, and also neonatal injury. It can affect any way, all these gets affected. What is the mechanism lying behind? It is the nothing but the insulin resistance, starts from adolescent age and as PCOS, and again continues during pregnancy as GDM, and later life it affects as IGT, early IGT, pre-diabetes or diabetes as such, which are all other NCDs. And of course you have more of inflammation which affects the placental function and fetal development. This affection of fetal placental function and this thing causes less nutrient and oxygen supply to the fetus, and also causes epigenetic changes to have long-term effects on the offspring. Thus, this overnutrition causes dysregulation of the maternal and placental metabolism and transport of all, not only glucose, lipids and amino acids, all leading to epigenetic manifestations and effects later in life as increased weight and all NCDs. So, this obesity in the mother causes fetal dysregulation of glucose, insulin, lipid and amino acids, and this causes increased placental macrophage infiltration and pro-inflammatory cytokines like increasing the interleukin 6 and tumor necrosis factor, and leading to increased insulin resistance, which again increases the leptin, tumor necrosis factor, and decreases the adiponectin, and increasing the adipose tissue lipolysis and increasing the placental fatty acids. This again gets increasing further the insulin resistance, and all this becomes a vicious cycle. So, in this way it affects every causes problem everywhere, like in the intrauterine environment, increases all these factors leading to increased oxidative stress and overactivation of the placental macrophages. And in the fetal epigenetics, it causes differential expression of microRNAs, DNA, hypomethylations, and brain derived natriuretic factors silencing. And it again affects the milk, breast milk composition, like increasing the interleukin 6 and also decreasing the neuroprotective factors. That's again very much critical for the cognitive function. And fetal microbiome, it's again very much altered. And in the brain, it impairs the serotonin signaling, impairs the dopaminergic signaling, and peroxidase lipid buildup, and microglial overactivation, increasing the oxidative stress, pro-inflammatory cytokines and oxytocin. And if you see the placenta, if you compare the placenta of the normal and the obese, here again in obese pregnancy there is reduced placental cell turnover. You can see that the there is lower detected levels of apoptosis marker, that is cytokeratin M30, which may contribute to the overall large size of the placenta, and there is also alterations in the vessel causing vasodilatation, affecting the vasodilatation, and mainly affecting the nutrient and oxygen supply to the fetus. And as we said earlier, it may go up till stillbirth also. There is a higher rate of maternal inflammatory response lesions consisting with chorioamnionitis. So, you can see the difference between the both obese and normal weight. So, how much weight gain is normal during pregnancy? Of course, we see most of the girls putting on more weight. That's again not good. Maximum they can go up to 12 kgs, and again a lady who is having a BMI of more than 30, she is again considered as obese. And this much of extra weight is due to the growing fetus and storing of fat to make the breast milk later, all that. But of course, it should not exceed 12 kgs. And again, not only that, it gets transmitted from generation to generation. And first and foremost,